Dr. Colin Amos is just one of the thousands of dedicated health practitioners committed to going the extra mile to flatten the curve despite all the dangers he's exposed to. Now that he has a new normal, he details how an average day looks like.
My typical day starts at 8 in the morning and could easily last over 11, 12-hour shifts. And on a 7-day basis, it can be quite taxing. So it is very difficult, but we enjoy it. In the first 2-3 weeks, of course, there was a lot of panic and a lot of patients did come into our own practice. But we have ways in which we then alert them. There's a lot of teaching and education that goes around it. Right now, it's kind of relaxed, but I'm a little bit concerned that we're going to see an upsurge in the next 2-3 weeks.
In the wake of growing figures, Dr. Amos says there is undoubtedly some anxiety felt by not only himself, but his colleagues too.
Naturally, doctors will also be concerned. I mean, the level of unpreparedness that we all are going through now with the sudden increase in the numbers of the people that are infected or affected is very difficult. So it's a very, very stressful situation. I've got to keep up with those patients that come through into the practice, from all sorts of backgrounds, all sorts of socioeconomic levels, and manage them appropriately, and then go back home into my own community. So there's a lot of stress that comes into it. Also, I've got to take care of my own employees that most of the time don't even have adequate transport to come to work.
Medical experts and epidemiologists anticipate a surge in the number of cases in the country. As it stands, there's a shortage of masks, gloves and ventilators, and unions representing healthcare workers are outraged by what they call the health department's slow response.
There are no efforts even to buy and procure these PPEs. For instance, there is no single province that have demonstrated to us that there have been efforts in their attempts to secure, other than to say they have placed an order. Since last week Thursday, even if you can ask each and every MEC today, they will just tell you the same thing. We have put an order to procure this. Yet our members are on the ground, on the line of duty, doing this thing without this thing. So the truth of the matter in the end is that our government is not prepared for this.
Health workers as well are in a danger, and they are not even compensated for that matter in this regard. So we are worried that it looks like government is moving in a sluggish pace, but we know that our country needs these health workers, and the country knows that these health workers are very important. And for us, it's a non-discussable issue. It's a non-starter. It must just be provided for.
Due to a busy schedule and unforeseen circumstances, the Gauteng Department of Health was not immediately available for comment. Nosipho Mncube, SABC News, Johannesburg.